sure is that powerful, Kevin? Is it that powerful? You can. Way over there. Wow. I'll remember that.
You could tell I needed a tune-up in my car.
Are we good to go, Madam Clerk? Great, thank you. So thank you again for joining us for this latest update on the COVID-19 situation and the city's activity to protect our community. Things continue to evolve. Sorry. I got the jump on you there. My apologies. We have a translator with us. So things continue to evolve quickly, and we wanted to keep the community up to date. And we appreciate the ongoing support of our local media to help us communicate these important messages. There are 5 new cases of coronavirus in the city of Hamilton, all travel-related. That brings the total in Hamilton to 10. We don't have any additional information at this point in time on those cases. And the medical officer of health is in high demand these days, and you might appreciate that she will not be joining us today, but will be joining us for upcoming briefings tomorrow. We believe every possible measure should be taken to keep all members of the general public informed of the ever-changing situation. So, in addition to our media briefings and releases, we are planning to hold a virtual town hall on Wednesday, this coming Wednesday at 7 p.m., where Paul Johnson, myself, and the Medical Officer of Health will share updates with the community at large and respond to the variety of questions and continue to flow into our public health department and to our emergency operations center. So residents will be able to provide an opportunity to pose their questions during this virtual town hall. With regards to council meetings, council committee meetings and council meetings, we have consolidated all of the agenda items that are necessary to approve, and we will be meeting Friday morning at 9:30 to do a special GIC and a special budget meeting, and hopefully council to ratify those items right after that. That's in an effort to minimize the amount of contact that needs to happen in our community and in our council, and continue to work on the important issues of dealing with the virus as we go forward. Agendas will be available by end of day tomorrow. That'll be by end of day tomorrow. And I encourage delegates to provide written delegations instead of attending in person. Additional public health and social distancing precautions will be in place at that meeting. We've invited you here today to share with you some additional actions that the city is taking that will impact our community. And as mentioned, there are primarily operational items. I recognize this is a particularly difficult time for everyone, and that these changes have widespread impacts on all of you, but are absolutely necessary to reduce the risk of virus spreading. And with that, I'll turn it over to Paul Johnson, who can provide the details on the operational changes they're recommending as of right now. Paul?
Thank you, Mr. Mayor, and good afternoon, everybody. As I have been doing in our press conferences to date, I want to start by acknowledging some really important groups who are helping us get through this emergency. Today, I want to make special mention of the incredible support and working relationship we have with the many unions that represent workers here at the City of Hamilton. They have all understood the importance of flexibility and understanding so that we can continue to deliver the essential services of the City of Hamilton, and I appreciate every single effort that they have made to, 1, communicate with us when they have concerns, and 2, allow that flexibility for us to do things like deploy workers from certain areas of the city that are now shut down to important areas of the city that are doing work. Primarily, that has been in the public health services area. So I do really want to extend my thanks to the union leadership of our various unions that represent our workers here at the City of Hamilton. As you know, on Saturday, we announced that we were shutting down a variety of facilities, and over the weekend that occurred. Those facilities will, now that they're closed, undergo a deep cleaning and some disinfection so that when we are ready to reopen, they will be ready to go. We'll also use this time that we have, albeit unexpected, to do some minor maintenance and to ensure that when these facilities are able to reopen, they're in great shape for our residents. As you heard in an earlier press release that went out, we have 2 assessment centres now in the City of Hamilton, one at the West End Clinic under the umbrella of Hamilton Health Sciences, and one at the East End Clinic under the umbrella of St. Joseph's Healthcare Hamilton. This is a result of primary care and our hospital teams coming together and working to ensure that these assessment centers could get opened, and I think it's an important next step in our work on this pandemic. There are a couple of key things that were mentioned in that press release that I would like to, on behalf of Elizabeth, reinforce for the public. First, to avoid unnecessary volumes, I've got to slow down, they tell me. I got to get some sleep too, and I got to slow down, and I got to eat better. So there's 3 things that I'm taking away from today, but one of them is I will slow down. 2 key things to take away from the assessment center announcement. First, to avoid unnecessary volumes at the centers, every person is encouraged to do the self-assessment that is online at ontario.ca. Secondly, if then you are showing symptoms, you will need to call public health at 905-974-9848 or your family doctor, and remember that appointments at the assessment center are booked. They are not a drop-in center. So if we do that together, we'll ensure the orderly movement of people towards these assessment centers, which, as I say, are an important next step in dealing with this pandemic. It's also important to note that additional COVID-19 assessment centers may open at a later date as needed. You've heard as early as just a few minutes ago from the province, it remains very important to underscore the steps that we can all take to stop the spread of coronavirus. Social distancing is one of those important pieces. There are lots of ways that we can do this, though, and still be active and still be enjoying our community. Walking, going for a hike, being outside with proper spacing is great. Being at home with family, again, and doing some of those activities is perfectly okay. You will have heard, and we will be assessing the recent information that came out just a few minutes ago, that the province is encouraging people to avoid restaurants and bars. And I was actually going to make mention of that in light of what tomorrow is. March the 17th is a particularly day of social activity, and I was going to underscore that social distancing is critically important on St. Patrick's Day. But obviously the province is taking some next steps in encouraging people to exercise caution in terms of the social activities that they undertake, and whenever we are out in public, to ensure that social distancing is our goal. So the one way that we can do that together with the services at the city that continue to remain open is to use alternatives to coming in person to our services. The City of Hamilton has a number of ways that you can use online or phone options to do the work that we need to in terms of interacting with the city. You can apply for child care subsidy. You can pay your taxes. You can apply for animal licenses, all online or over the phone. And we will be posting a comprehensive list of those services and links on our website tomorrow. So we're really encouraging people wherever possible not to access services in person. That way we will stop social gathering within the facilities that are open, but also it will be an easier way for you to access services here at the city. We've done a lot of work over the last few years in order to make our services available online and easy to use, and we encourage our residents and our businesses to do so. One announcement that is service-related we wanted to update you on today involves transit. Of course, with the city's adherence to the guidance that those who have traveled abroad, including the United States, should, upon their return, self-isolate for 14 days, we are assessing and have been assessing the impact that that could have on our staffing. In addition, we know that many families are challenged by the lack of childcare and recreational opportunities due to the closure of many of those programs. As a result, and as a result of not having the ability to redeploy people to drive our buses, we're announcing today that HSR will move effective Monday, March 23rd, until further notice, to a Saturday level of service from Monday to Saturday and obviously a Sunday level of service on Sunday. This change in service is to ensure that we can provide a predictable and reliable transit service, albeit it will be a slightly less frequent service in our community. Our challenge was, given the predictions we have on our staffing levels for drivers, if we took the chance and then didn't have enough drivers, we would have a haphazard approach to transit in this community. Many people would experience cancellations at the last minute and other impacts that would be negative to their movement around the city. So it may take you a little bit longer to get to where you're going, but the good news is that you will have predictable and reliable service in order to do that. So again, that is effective next Monday, the 23rd, but the changes in shift structures will start to occur for our drivers tomorrow, and we wanted to ensure the public was aware today so they could begin to plan for their movement next week. And again, this is all an effort to ensure that we have that predictable service. If we do have additional drivers available, they will be used to enhance service at peak hour and peak times during the week for sure. And as I mentioned, the Sunday schedule remains unchanged. People can follow all of the exceptions and get access to their routes and timing at www.hamilton.ca/HSR. The revised schedule will be posted by Friday, and our customers can continue to use all of the great links that we have to ensure that they know where transit is available and how it's available. At this time, there will be no changes to the DART service in our community. We are seeing a reduction in the number of people using this service due to some of the closures that have occurred. Some of the movement that happens on DARTs are to programs that are, of course, closed during this time. We want to thank our bus operators, our HSR staff, and union executives for their continued dedication and support during this challenging time. Lastly, I know some of you have been wondering about how we are addressing issues that may occur for our homeless and vulnerable populations. A meeting occurred today with providers of service to homeless individuals in our community, and by tomorrow we will have a plan in place in particular to deal with the isolation that may be necessary should individuals in homeless shelters or drop-ins exhibit signs of coronavirus. I'd like to thank all of our service providers in the community for their work and for our staff and housing services for working together to come up with a plan, and I hope to announce some of those steps tomorrow. We now have a detailed question and answer section on our website, the City of Hamilton's website, and I would encourage our employees and residents to find the details there. We have taken the steps so that all of our employees can access the information that they need to posting both our internal and external information on our City of Hamilton website. The reality is, for some of our workers, they don't have access to our intranet, so we want to make sure that they are able to find information as quickly as possible. As you know, and is at the bottom of all of our press releases and on our website, there are a variety of ways for members of the community to access information, both about the coronavirus itself and the public health information related to those who may feel that they've been exposed or may be exhibiting symptoms. And then our Hamilton.ca website includes tons of information about other elements of our services at the City of Hamilton. So again, to recap, one of the major service changes that will happen as of next Monday, March the 23rd, is that our HSR service from Monday to Saturday will operate on a Saturday level of service. Sundays are unaffected. And we will be, over this evening, taking a look at the latest information that came from the province just a few minutes ago and understanding how that will affect our services moving forward. Mr. Mayor.
Thank you very much, Paul. And thank you to all the first responders and community workers that are still heavily engaged, public health, the hotline calling center, paramedics, fire, and certainly here at City Hall, everyone's still engaged and looking to continue to work on protecting the health and well-being of all of our citizens, whether they're marginalized, seniors, and everything in between. We want to make sure that we make the right steps and the right calls to ensure that everyone gets what they need on the short term, and then over the long term look at some of the financial issues that the federal government and the provincial government are already starting to turn their mind to in terms of how they provide assistance to business and or residents that have lost income in our communities. And so we're going to continue that work. And in the meantime, we will encourage people to, when they shop, I've had it from good authority that on a national basis, there is no shortage of food and there's no shortage of delivery of food in the community. But what is occurring is that people are emptying the shelves. Please take only what you need. The shelves are going to be restocked. There's no need to hoard. Everyone needs to be able to get what they need going forward. And so please be reasonable when you're out there shopping. And I see that settling down in some of the stores as we speak. Beyond that, we want everyone to look after your neighbors, look after your family and friends, do help those that are going to need the help the most, and this is a good time for the community to rally together and care for one another and demonstrate that we can get through this together. On that note, if there are any questions, we're free to answer them.
Can you, either of you, talk about the steps that some local health networks have taken in terms of the screening process for people coming into the hospitals?
Better Paul than I.
So we'll have to get you some information. I'm not aware of the health sector screening. So in terms of our screening, the only place where there's really a heightened level of enhanced screening is in our long-term care facilities. So currently we're not allowing visitors in there, and everyone who comes in from a staff perspective or an external health provider is actively screened because of the vulnerable nature of our patients. We can follow up with you in terms of what's happening within the health sector more broadly.
There are 3 identified safe assessment sites now. I think you got the announcement earlier. St. Joe's out in the East End, the McMaster Urgent Care Facility, and another one on Stone Church Road, I can't remember the name of. So there's 3 locations where safe assessment can occur. And that was announced a little earlier on. So I think there was an email that was sent out on that issue.
Mr. Mayor, just to follow that, we had heard that Wesley might have offered up a location for an additional assessment center. Is that something that we have heard about?
We've had a lot of offers of different sites and different locations for different reasons. All of them are being noted and certainly have been sent off to the Emergency Operations Center. And as they're needed, they will be obviously looked at to see if they fit the bill or if they're going to be necessary, and we'll take up those offers when we have to. We've had other offers of facilities downtown, convention facilities, hotels that might be available if there's additional need for hospital space, and at this point that doesn't seem to be the case, but we're certainly going to keep them on file in case that need arises.
Do you know what the announcement by the Prime Minister today means for Hamilton's airport? It wasn't clear whether Hamilton's airport is closed to international travel or whether it can still get planes back from the Caribbean and from the U.S.
It sounded to me like it was closed to international travel, and that was only going to be focused in on Toronto, Calgary, Vancouver, and, remind me, Montreal. It didn't include cargo, and as you well know, that cargo in Hamilton is the mainstay of the airport, I presume, and I believe that cargo wasn't impacted by that. The movement of goods will continue. But I believe, and maybe do you have any additional information? I believe that the Hamilton Airport will not be taking any international travel. That's my understanding at this point. Paul, anything new?
So I do know there were a few exceptions in terms of countries, and I don't know where all of the international flights emanate in and out of. So there were a couple of exceptions. If those are there, obviously they'd be allowed to fly in, but the bulk of the international travel is now going to 4 airports in Canada.
The exceptions were Mexico, the Caribbean, and the United States, of course.
Is that the bulk of our international travel earlier?
Could be, so we'll have to double check on whether or not they're still going to be coming to the airport. I don't know about that, but anything else international, and there have been other international flights, but I'm not sure if they're current. But any of those other international flights coming from Europe, India, and other locations will not be coming. Kevin?
Are you looking at any curfews?
So no, not at this point.
What about, 'cause they've been talking about 250, limited to 250 people, but now they've been ratcheting it down to 50, maybe even 25, even 10. Is that in the planning stages?
So the step we have taken is that we are not within any of the city facilities, indoor or outdoor, allowing any event over 250. The smaller events, we are working with any event organizers. I can tell you that there are very, very few that are still left happening in the next number of weeks. So any event that's going on, we are asking them for what is their plan to follow public health precautions, because I think it is important to note that although there's an absolute guidance, and really it is everybody's strong guidance that large gatherings simply do not happen, even at those small gathering levels, we need to keep proper distancing and we need to make sure there's public health precautions.
Yep, go ahead.
The province's list said that there was 4 new cases today, and the city is saying there's 5. Could you identify what the discrepancy is?
So sometimes the discrepancy in the two websites is when they're confirmed, and that's when our numbers are. So the medical officer of health says now in the city of Hamilton there are 10 cases. So on occasion you may have noticed at one point there was only 1 listed in Hamilton but 2 listed provincially. It's as those cases are absolutely confirmed at the local level that they go forward with that. So the medical officer of health has indicated 10 cases now in Hamilton.
I'm also wondering about some more details about each of these new cases. You said that there are no details, but we've read in other media that there is information, like how 2 of these patients are allegedly connected to the 3-month-old that was infected. So is there new information, and if so, why isn't it being shared?
So we'll certainly pass that information on to the medical officer of health and public health and have somebody get back in touch with you with further information. Medical officer of health has said she's not going to come out every time there's a case confirmed and have a press conference around it. But she is tied up working with some health partners at this particular moment. We wanted to announce some of the operational changes. We'll definitely have public health follow up with you. Jasmine will take some of the information and make sure that follow-up is there. Read nothing into the fact that we're not here to provide the public health update. There are 2 parts to this, and there's major operational impacts that are going on today, and we wanted to make sure the public was aware of those at this time.
Well, I was also told that there's not going to be media releases every time that there's a new case. So how does the city plan on providing consistent information to everyone at the same time about, a public health crisis like this?
Which is what we're doing almost on a daily basis. So we're virtually have been here either at 2 o'clock or at 4 o'clock every day since the issue has begun, and we're going to continue that practice. So that will be ongoing. As we evolve through this issue, we will keep the community informed. Wednesday night will be a town hall where we'll share even more information with the public at large. And when there's information to share, communication is really how we're going to continue to give the public at large the confidence that we're on top of this issue. We're working with all of our federal and provincial partners, both on the public health side as well as on the operational side. And as issues evolve and as the public needs to be informed in terms of the operational changes, we will inform fully and completely, both through social media and through press conferences and through the town hall that we're doing on Wednesday.
All right, folks. You mentioned the news that's just out from the province about the recommendation to close bars and restaurants. Does the city have any role other than encouraging people to do so?
We haven't had time to assess this. So this happened at 4 o'clock, or just about as we were stepping out here. So EOC is going to have a look at that tomorrow and actually respond to that. Province is making that recommendation. I don't know that it's an edict at this point. But certainly a strong recommendation, and I would imagine that many of the operators out there would probably be inclined to follow along. So I would encourage people to listen to the good advice of public health in Ontario, and I have no doubt that our local public health, once they've had an opportunity to assess that, will probably concur.
I was just wondering, in essence, would the city reach out to operators, especially with St. Patrick's Day in the offing, as you mentioned?
Yeah, so one of the things that we've been working with the Chamber of Commerce and with our own economic development to look and find ways of supporting local businesses throughout this entire event, let alone what's happening, what the province just announced. And so that's an ongoing effort. We're looking at ways and means where we can support local businesses and employees going forward. On a localized basis. So make recommendations to the broader community how they can continue to support the local restaurateurs. Many of them are already going to takeout only. I think the Mandarin has announced that they're only doing takeout. They're not doing in-house restaurant service. I imagine many of the other restaurants will do the same. But you can continue to support those restaurants by frequenting their takeout services, and that will continue to keep them in business and continue to keep them employed as well. So I think those are positive steps. The Chamber and the city will likely come up with more strategies in how we can support these local businesses get through this process. Kevin?
Just with city-operated facilities, have you talked to the private sector, Global Spectrum, that stuff, with regard to any events at First Ontario?
Yeah, as far as I know, we have, and Paul will talk to you about that.
Yes, we have. We've talked to both the stadium, First Ontario Centre, and the convention center. Most of the events in the near future have been canceled. So we are working with a couple of events at the convention center that still we're thinking of going ahead this week. Again, our strong encouragement is following on the Ontario advice and the federal advice around gatherings. So we're strongly encouraging those folks to reconsider holding those events. Other events that are coming up that haven't been canceled yet are a ways out. They're into the middle of April, and they'll be assessed as we come forward. So we pulled together the principles that help us operate those facilities. They were all in complete agreement that their first and foremost goal is to protect the public, and so they've been very cooperative in ensuring that the events that were planned, we talked with the organizers, and as I say, many of those have been canceled.
A quick question about the logistics of the town hall on Wednesday evening. You said residents can submit questions that they may have. Can you talk a little bit about how they can do that, especially if they're encouraged to stay inside?
Yeah, so it'll be a live an audio town hall. Normally we would have, I think we've commissioned a company to do the live streaming on that. And they can actually dial in, and the moderator will actually take questions and then forward it to the participants on the call. So we will get moderated questions from the moderator, and we'll be able to answer them as we go through the town hall process. I believe it'll be a 2-hour town hall, 1 hour, 1 hour town hall. Sorry. My previous experience with town halls has been that a good many people dialed in, 70,000 as I recall last time we did this, and that could be a similar number in this place. So we won't be able to answer all the questions that come through, but hopefully we'll be able to touch on many of the questions that we already know are being asked through the public health hotline and Q&As that we're getting through email into our office. So we'll try and cover those off right off the get-go, and then hopefully get as much questions in as we can.
The details will be on our city website of how this will all work.
Details will be on the city website on how this will all work, and we'll be sending out a media advisory on the functionality of the town hall as it probably by tomorrow, I would imagine. And that's great. Yep.
You mentioned, of course, that you're going to be doing sort of a condensed
Yep.
budget and GIC upcoming on Friday. If people have questions about ongoing planning issues or things where there were necessary public meetings to advance a particular project, things like that, can everyone assume that there is a default 2 or 3 week delay in those public processes, or could approvals be coming regardless for ongoing?
Well, the approvals have to go to council, and I think the essence is that we're doing a council on Friday that to forestall any future council meeting and having to gather. So these are critical issues that need to be approved. Everything else is deemed to be not critical and can wait. I'd imagine that folks, I think folks are still working upstairs, and for those that have issues with planning, they can still go to the planning department and keep working through those issues, either virtually or directly. And when this issue passes, hopefully not too far down the road, we will get back to the regular committee schedules that should be, and we don't know when that's going to be. So at this point, it's an open question. All the protocols necessary for separation and good health and hygiene will be evident at our meeting on Friday. And we are also looking at potentially delegated authority to staff to deal with some of the issues, not unlike what we do when we're a lame duck council, at the end of the term, that we provide delegated authority to staff under certain circumstances so they can deal with any critical issues that might arise over the time that council will not be meeting.
You touched on this, Mr. Mayor, but I noticed that Mayor Tory in Toronto has been convening meetings to talk about economic crises, essentially, with businesses closing and things like that. And we just saw what the province has recommended now for bars and restaurants. Are you anywhere close to talking about things like tax relief or individual businesses that would struggle through this time period, or?
No, and I think that'd be a difficult issue for the municipality to deal with. I think it's more in keeping with what the federal and provincial governments are prepared to put on the table that we might access on behalf of local businesses. So we're going to continue to work with them to see, what kind of EI benefits they're proposing, what kind of break they're proposing for employers in terms of tax relief. I think a lot of those measures will come from the federal and provincial governments, certainly not so much from the local government. But we'll look at all opportunities to help local businesses get through this. So I'm not saying no to any of that, but I think that realistically, I think most of the revenue and financial issues will be dealt with by the federal and provincial governments.
The last thing, since you mentioned it, the offer of downtown facilities or even hotels, if they're needed down the road, hopefully they're not, would that fall into the category as well for dealing with homeless people who are need to be quarantined at some point, for example?
Could be. It's still an open question. I know that they're looking at those issues and are fashioning a response to that imminently. But Paul, any additional thoughts?
Yes, so absolutely. There's very few options if we have more than one or two individuals that are experiencing symptoms. So we've been canvassing around, and it's been really great to see the private sector step up and offer some of those. We've also indicated to our shelter partners that we will fund the ability for us to ensure that there's a safety for those folks. The last thing we would want to see is, as a result of the people with symptoms, that we would have to say shut down an entire shelter. So our goal is to isolate. The shelters can isolate small numbers of people within their shelter operations. It's when it becomes more than just a couple of people that they're saying to the city they don't have that capacity. So we've assured them this morning we will ensure that capacity is there. We will fund that capacity to happen, and it's great that we've actually got some options. We'd prefer not to have it scattered. We'd prefer to have a single entity where we could go and staff, provide food, and do all the things that we need to do to isolate individuals. No different than what individual residents are doing in this community. But of course, when you're homeless, the other supports that we need to provide need to be there as well. We hope to. We're meeting again at 8:30 tomorrow. They met at 8:30 today to brainstorm. We were able to bring some things to the table. Tomorrow we want to finalize the plan. Expect that to happen late in the morning, and we want to be able to announce our plan so that folks are aware of that tomorrow as well. This also will involve drop-in center provision as well, because many of the areas that offer that kind of social environment and ability to be in social spaces have closed. Rec facilities and libraries were often places where people would go to get off the streets and have a little bit of a break from the shelter, and those of course are all closed. So we'll be doing both of those things and hopefully be able to update you more on that tomorrow.
I understand there's right now apparently no new details about the 5 new cases, or no details being released today, but there is some details about prior cases, and I wanted to ask about the 3-month-old baby. So can you confirm that this was in fact a travel-related illness or contraction of COVID-19?
Well, all 10 cases that are currently confirmed in Hamilton are travel-related.
Okay. We just heard reports that that might not be the case with the 3-month-old.
So the other piece is we'll follow up and get you connected with public health to do that. Elizabeth provided some information for us to share today. They're all travel related, the 10 cases, but we'll make sure that there's that follow-up conversation with public health directly for you.
Thank you all very much.